Go ahead.
Thank you. Good evening, everyone. I'm Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, Pune. And here I am in yet another topic of our FB Live, where we are speaking about infertility and various things associated with it. Recently, Pune Center has completed 3 years of its successful devotional work in fertility, and we have launched an initiative called as Chuppi Todo or Speak Out. So you need to speak out regarding your infertility problems, and with this campaign only, we'll be taking over. That you can call our helpline numbers and ask us regarding any query related to fertility. Answering such more queries, we come up through our FB Lives, and today's FB Live is on the topic of whether summer is hampering IVF success rates or should IVF be done in summer season. So let's talk about it. Friends, there is a seasonal variation, and this seasonal variation affects our body to some extent. That is an acceptable fact. It has been shown that during summer season the ultraviolet rays are coming directly or perpendicularly on the body surface, and therefore uh, the exposure to this ultraviolet radiation is going to be more, and the vitamin D levels in the skin are going to be generated more. So it has been shown that in studies done worldwide that the conception rates, the ovulation rates, the endometrial receptivity all go a little bit down in the winter season, and because of variety of factors, the conception rates, the ovulation and the endometrial receptivity all go higher in the summer season, which is considered to be June to September in the Western world, and in India, it is considered to be between March to June. So this is the period where the conception rates have traditionally been higher. May it be a natural conception or a conception which is occurring after taking any sort of treatment. So if we consider male and female factors separately, in female fertility, the ovulation rates are going to be high in summer season. Most of this is attributed to the high vitamin D levels and the importance or the usefulness of this in fertility. We all know that the AMH, the ovulation, the multiple molecular things which are involved in ovulation are vitamin D dependent, calcium dependent, and so on. So therefore, those who are trying in summer season, their conception rates are going to be high. The endometrial receptivity is again improved in summer season. Most of this is again attributed to the high vitamin D levels. So the receptivity increases, and therefore the chances of clinical pregnancy rates, they are definitely increased. It is not transit. It is not transmitted into live birth rate, but yes, definitely there is a higher clinical pregnancy rates in summer season. In men, it is thought that heat will decrease the process of spermatogenesis. But if we see that the excess heat is avoided by avoiding too much of tight clothes during summer, by avoiding too much of prolonged sitting during summer, and good hydration, if you're maintaining good hydration, then the conception rates or the male factor of fertility also doesn't go down, and therefore the vitamin D levels which are going to rise in the men can also be helpful for treating certain sperm dysfunctions as well, and therefore this is also going to increase your fertility rates. Now, we have talked about natural conception. When it comes to fertility, both IUI and IVF success rates have not gone down. May it be summer season. This is because of all the factors which are studied. So the oocyte quality, the vitamin D levels are going to improve, and therefore the oocyte number, oocyte quality is going to be very good, and therefore the fertility rates are going to be extremely nice. Then the endometrial receptivity is going to be nice, and therefore there is no harm in taking treatment during summer season. So if you are going for IUI, if you are going for IVF, and you are worried that summer is going to affect your success rates. That's not a case. It is going to help you in a positive way, and therefore you can undertake your fertility treatments even during summer. So that was a quick session about does summer season affect your fertility rates or IVF success rates? And the answer which I have provided clearly tells that yes, you can take treatment in summers and your fertility rates or the success rates of IVF are not going to be hampered because of the summer season. So thank you for that. Any questions are most welcome. The first question is IVF more successful in summer? So if we consider the statistics, yes, it is to an extent. The fertility rates and the success rates of IVF are a little bit higher in summer because of the improved vitamin D levels, the improved uh, hormone plethora because of that in the ovaries, in the spermatogenesis processes. This is going to definitely help and improve our success rates. The next question is what activities to avoid during IVF? So there is again a myth that after IVF you have to take complete bed rest. That's not the case. You can work, do the normal work which you are doing. So if you are working at home, a housemaker job, you can continue doing that. If you are going to office, you can do that. Only high intensity physical exercises are told to be avoided. So, horse riding, prolonged standing, bungee jumping, pressurized, where there are pressure changes, these things are these things have to be avoided once you are done your IVF. The rest, all other normal activities, the exercises, walking, jogging, all are allowed even if you're doing IVF. Next question by Shravanti is how can I make my IVF successful at first attempt? So basically, the success rate of IVF depends upon three factors. The first factor is the embryo. The embryo has to be excellent, and therefore the oocyte and the sperm quality has to be very good. So ensure with your doctor that your oocyte and sperm quality is good, and therefore the resultant embryo has to be really good to give you a good success rate. So the embryo quality can be assessed on visualization, so you can see the grading of the embryo, or it can be assessed by genetic testing by doing a pre-implantation genetic testing. The second important thing for important to improve the IVF success rate in the first attempt are the good endometrium. So the endometrium where the embryo is going to be implanted has to be really good. The endometrial thickness has to be between 8 to 12 millimeters to give you optimum success rates, or 8 to 14 millimeters. And the blood flow of the endometrium has to be really good to give you a proper success. So that is the second factor. The endometrial receptivity along with the endometrial thickness is also very important. The third factor is any issues around the uterus or in the body. This is also, that is the environment for the embryo is also going to be important. So if there is any swelling in the uterus or adenomyosis, if there is any tubal factor infertility or hydrosulfings, if there are any thrombogenic factors in the blood, these all are going to hamper your IVF success rate. So therefore, the environment around which the embryo is being put is also very important. So these three factors, if you ensure, you're going to get a good success in the first attempt itself. Next question: what to do after failed IVF attempts? I would take this as a continuation of the previous answer. So, three factors you have to evaluate if IVF has failed: whether the problem was in the embryo, whether the problem was in the endometrium, or whether the problem was in the environment where the embryo was put, is to be assessed. Along with that, the genetic testing of the couple may have to be undertaken. The sperm DNA fragmentation test may have to be undertaken. Y chromosome microdeletion in selected cases. Along with that, we have to analyze what went wrong. Was it the embryo, or was it the endometrium, or the endometrial receptivity? So this has to be analyzed, and if any specific cause is found, we need to address that. Sometimes a specific cause may not be found, so we have to do other detailed investigations, such as the immunological causes, or if there is a problem with the interaction between the man and the wife, by analyzing the T cell cross match. So these are some rare reasons which can also cause IVF to fail, and therefore we need to analyze this as a whole and then advise you treatment for recurrent implantation failure or IVF failures. Thank you. So yeah, the next question is what is not allowed after embryo transfer. So as we said that no major change in the lifestyle pattern has to be followed, not lifting very heavy weights, avoiding too vigorous physical activities. uh, if a sexual contact is established, the barrier contraception has to be used. Long distance journeys may be avoided during this period. There are certain foodstuffs raw papaya, pineapple, which have abortifacient potential, have to be avoided. Two or more than 2 cups of coffee have to be avoided. So these are certain things which are need to be avoided after embryo transfer. What is the most painful part of IVF? IVF is painful is itself a myth, I feel. IVF is not at all a painful procedure. All the things which are done in IVF are most of the time painless. The injections which are given are painless injections, very small injections. The ovum pickup part, which is slightly painful, is done under anesthesia, so that pain is also not there. And the embryo transfer part is not at all painful. So IVF is painful is itself a myth. So thank you for your patient hearing. For now, this much. And if you have any queries and related to infertility, please connect to us. We are into our campaign Speak Out or Chuppi Todo, and this is our helpline number which is given below. You can connect to us on this helpline number, or you can visit one of our centers. One is at Wakad, Kaspatevasti, and the second one is at Arisa Avenue, Kharadi. So thank you and bye for now. See you in yet another FB Live session on next Monday. Thank you.